Also, interestingly, Tapan, that, while on the one hand you see health costs going up so significantly, and recently we saw a lot of outrage, public outrage about fancy 5-star hospitals charging, the charges going through the roof in terms of small ailments. While premiums have gone up, but they haven't gone up in equal proportion. So would you like to tell people that, hey, look, while your costs are going up, we still remain one of the cheaper places in this world where you can get a cover at not that ridiculous a price?
Yeah. So for that, I think what people should do is compare what and how much they pay for health cover in the developed markets compared to what they pay here. The difference is between, say, over 10 lakhs to 10,000. I think that is the scale. I think for the premium that is being paid in India, the kind of return or the value that you get is phenomenal. As a professional, and I've seen the world, I can make the statement very comfortably. But more than that, the other side of the story also. When I talk to good doctors and I talk about the charges, and I'm not justifying the full, I'm just doing a part of it. One of the answers is that, Tapan, today if you look at technological advancements, the machines that is there for good treatment, is also expensive. Yeah. And for us to keep on getting the best in India, we have to charge to be able to sustain that business. I think to that point, they are right. And that's why at Bajaj Allianz, I don't think that we push people to go to low-end hospitals. To that point, we agree. But if I look at, let's say, the industry losses in health, you'll be surprised to know close to 20-25%, the reason for the claim is fever of unknown origin and dysentery, diarrhea. Unbelievable. As a child, if I had fever, one cold stare from my mother, Insured was perfectly fine, yeah? And if I had dysentery, it just meant that somehow I would resist the temptation of having a samosa for 2 hours. I think that is all. And I was perfectly fine.
But since we started talking about from a social issue point, and that's something that you're very passionate about, is this also a change in the way we are thinking as a society, that I want to give myself the best treatment?
Yeah, the best treatment is right. But all I am trying to say is, one should
distinguish. At every point of time.
Yeah, one should distinguish that if I have dysentery, do I want to go to a super specialist hospital? I think that is the only small distinction I have to make. Yes, if I have an ailment, I should go to the best hospital, and an insurance company, it is morally bound to us to give you the best kind of claim in terms of whatever the expenses be. No cutting corners there. I'm very particular, and if you look at my products, I don't try to put those sub-limits and try to cut corners. I want people, when they have a serious ailment, to get the best treatment by the best doctor, and whatever it costs, and if they're covered, we should pay for that. And I'm very clear on that. At the same time, my request to the customer also is that when you have illnesses like this, which are not life-threatening, which are not significant, it's a normal course of infections which happen and you get recovered well. And there, if you're getting recommended to go for a 7-day stay in the hospital to recover, I think it's better that we start having a second opinion and start looking at it. Because this balance is critical. So I think we should distinguish between what is life-threatening, what requires super specialties, or what is something which can be treated by a regular hospital on that basis. Because when you do that balance well, I think the industry goes well. Because we forget that the insurance companies charge premium based on the loss ratios. Right. So if the loss ratio starts going to the roof, the premium will follow suit. It's a question of and that is why it will go out of reach of many people.
The whole concept of pooling
insurance, exactly. Right? So as a responsible citizen, I think we should try and balance that so that these things don't go out of control. I think that is